Good evening, Berkeley, and thank you for joining me for my twice-a-week update on the City of Berkeley's response to the COVID-19 pandemic. And I want to start out like I have with every single one of my updates to thank our essential staff, including our city staff and first responders that are working to keep our community safe and provide essential services during this challenging time. I want to thank the frontline medical staff, the nurses and doctors and hospital staff that are providing care for the sick and comfort for the families that have been affected by this virus. And lastly, I want to thank you, the Berkeley community. It's been over 6 weeks since the shelter-in-place order was put in place. We know it's been challenging. Certainly, it's been very challenging for our businesses and nonprofits. But by staying home to save lives, you are working to not only keep you and your family safe, but to also keep our community safe. And it is having an impact. So please continue to stay home to save lives. When you do leave your home, please practice at least 6-foot physical distancing from those that are not in your household, and please remember to wear a face covering because this is essential to reduce the spread of this virus and also to work to reopen our city and our economy as quickly as possible. I want to provide an update on the number of cases as of this morning. There are 53 confirmed cases of COVID-19 in Berkeley, and as we know, several weeks ago, there was sadly one death of a Berkeley resident, although to our knowledge, there have been no additional deaths to date. 1,152 tests have been conducted, including 169 tests just in the past week. And this is due to us launching several weeks ago our own testing site, which has given us the ability to expand testing of essential workers and soon City of Berkeley residents. And of those 1,152 tests, 4.6% of those tests have returned positive. The City of Berkeley has set up a new dashboard that is being updated daily, providing information on the number of cases and tests in Berkeley. As we know, Alameda County has a couple of dashboards, one on confirmed cases and on demographic information, and also on the number of cases by city, and another on hospitalization rates and deaths. And so we are going to be adding more information on this dashboard, but please go to the City of Berkeley's website, cityofberkeley.info/COVID-19 to access the dashboard and to stay up to date on the number of cases in Berkeley. The updated shelter-in-place order went into effect today, and it is in effect until May 31st. Some activities such as construction, landscaping, and other outdoor businesses have been relaxed. Our city's skate park has been reopened, but athletic facilities that involve shared equipment or physical contact are still closed to reduce the spread of COVID-19. So please visit the city's website, cityofberkeley.info/COVID-19 for information on the new shelter-in-place order and what activities allowed, as well as what recreation facilities are open for use. Just an update on testing. Starting today, we'll be able to test all Berkeley residents and workers who are symptomatic. And this is a step forward in our efforts to expand testing so that we can understand the spread of the virus in our community and also work to implement the indicators that have been put forward by Governor Newsom and regional health officials to assess what steps we need to take to reopen our economy and to relax some of the restrictions in the shelter-in-place order. People can set up an appointment to be tested at 510-981-5380. And the city is testing asymptomatic people from high-risk populations as well, including people experiencing homelessness and also those living in assisted living facilities. And so we're working to expand testing capacity, but if you are symptomatic and you are a Berkeley resident, you can access testing if you are not able to access testing through your healthcare provider by calling 510-981-5380. I want to provide an update on our city budget. According to a report by our city auditor published last week, the city will face decreased revenues as a result of the COVID-19 state of emergency. And we need a long-term plan to plan for these financial shortfalls. So the city has begun the process of developing our budget for the next fiscal year. And at this time, we are expecting a $25.5 million shortfall in our general fund. So please stay tuned for information about the City Council's budget process and how you can weigh in to help shape our city budget and to make sure that we can prioritize health and safety and essential city services. And lastly, I just want to provide an update on crime. On a typical week in Berkeley, there are over 200 calls for service. During the shelter-in-place order, that number has dropped to 135 to 145 calls a week. We are seeing most of the calls around petty theft and grand theft and some property damage and other aggressive behavior. And these preliminary figures, which need to be vetted, do provide a snapshot of what types of crimes are occurring in Berkeley. Crime is going down, but crime is up in certain areas such as property damage, robberies, theft. And we've heard from some businesses in the downtown and Telegraph that they've seen an increase in crime, including vandalism and damage to their businesses. So to help our small businesses fix the damage occurring to their properties, I have submitted an item along with council members Harrison and Robinson for the city to establish a business damage mitigation fund, and the city council will be discussing that on May 26th. So thank you for tuning in. Please continue to stay home to save lives. Please practice physical distancing of at least 6 feet when you are with people not in your household. And please remember to bring a face covering and wear your face covering when you are outside. This is making an impact. It is helping flatten the curve. And please join me on Wednesday for another update on our work around COVID-19. Please be safe and healthy, Berkeley, and have a good evening.